About 1/3 of all patients who have had cataract surgery will experience a secondary clouding of their vision known as a clouded posterior capsule. Experiencing a secondary clouding of your vision can be extremely frustrating, but you'll be pleased to learn that this cloudiness can be corrected easily with the light of a laser instrument. To better understand your condition, let's review your cataract surgery. Light enters your eye through the cornea and passes through a transparent lens which focuses the light on a thin layer at the back of the eye called the retina. As long as the lens was clear, a sharp image was formed. But when the lens became clouded with a cataract, light could no longer pass through as easily, and images became faint and hazy. Surgery was then performed to remove the clouded lens. First, your surgeon opened a thin membrane that completely surrounds the lens and cataract, called the capsular bag. The cataractous lens was removed from the bag, and the back part of the capsular bag was left in place. Leaving this thin membrane has proven to significantly reduce some of the risks and complications normally associated with other techniques of cataract surgery. The capsular bag also serves as a platform for the placement of an implanted artificial lens. A secondary cataract is a clouding of this remaining capsular bag. In order to restore vision, this cloudy membrane must be opened. Traditionally, this procedure would have required actually opening the eye and cutting a hole in the capsular bag. But today, the Yag laser can perform the same procedure without opening the eye, thereby removing the risks normally associated with conventional surgery. The procedure is painless and will be done on an outpatient basis, taking only a few minutes. Focused laser light enters the eye and strikes a small segment of the cloudy tissue. This causes a precision opening of the membrane without damaging the retina or surrounding tissue. Since the membrane also supports the intraocular lens, the hole is made as small as possible so that the image can again focus clearly on the retina. You may be given some eye drops to use after the procedure, and you'll be allowed to go home soon afterwards. The Yag laser treatment is generally very safe and effective, and lasers have been used by ophthalmologists for over 20 years. As with any such treatment, theoretical risks do exist, although the risks associated with this laser treatment are considerably less common than those of conventional surgery. Risks associated with this procedure include elevated pressure, cystoid macular edema, delayed retinal detachment, and damage to the IOL. If you desire additional information on specific risks, please ask.
You know, at first I thought the doctor didn't remove all my cataract when he operated on me last year, but now I understand that he left the bag in my eye in order to avoid future complications. Now, what's so incredible is that I can see so much better now after the laser treatment, which I only had yesterday. It was completely painless. All I saw was a few flashes of light, I heard a snapping sound, and it was all over.
Yag laser treatment is a real testimony to modern medicine. Thanks to your doctor's tremendous investment in both time and instrumentation, your vision should soon be as good as it was before.